Also happening, a shocking and confusing move as Health and Human Services Secretary Robert F. Kennedy Jr. is removing all 17 members of the CDC's Independent Vaccine Advisory Committee.
Yeah, these are the experts who help decide U.S. vaccine schedules. Senior health correspondent Monica Robbins explains what happened and why.
Kennedy announced the change in an editorial in the Wall Street Journal, accusing the CDC panel of being, quote, plagued with conflicts of interest and little more than a rubber stamp for any vaccine. The committee makes recommendations on who should get what vaccines. Now, in case you're wondering who they are, well, the Advisory Committee on Immunization Practices, known as ACIP, is made up of public health experts such as pediatricians, epidemiologists, and geriatricians. They make recommendations to the CDC about vaccine schedules, including those for childhood vaccines. They hold public meetings several times a year where data is presented and reviewed. The CDC director then decides whether or not to follow the recommendations. The panel goes through an extensive vetting process before being appointed, and they're required to disclose conflicts of interest, and they can't vote on a vaccine if a conflict exists. The CDC released a database in March, but much of the information was already public about their connections to clinical trials and research. Now, this move is seen as the most aggressive of Kennedy's actions so far to reshape U.S. vaccine policy, from someone who rose to prominence in the anti-vaccine movement and made several debunked claims about vaccine harms. In his editorial, Kennedy called for a clean sweep of ACIP, but it's unclear how quickly he plans to fill the now vacant positions or whom he plans to choose. The reported new panel is set to meet later this month. Monica Robbins, 3 News.